We're joined now by Professor David Nabarro. He is a special envoy to the World Health Organization on COVID. He reports directly to the Director General. Professor, welcome to Spectator TV. 36.5 million cases of COVID across the globe, over 1 million fatalities. Are we past the worst or not? Can we see an end to this yet or not?
Thank you very much, Andrew, and I'd like to greet you and greet everybody. Sorry for being a bit late.
No problem.
To go straight to the question, no, we're not past the worst of it. My own view is this virus is actually towards the beginning of its relationship with the human race. Our estimates suggest that possibly as many as 10% of the human population so far have been exposed to it. There's still 90% of the human population, an awful lot of people who are susceptible to it. So we're saying that we really do have to learn how to coexist with this virus in a way that doesn't require constant closing down of economies, but at the same time in a way that is not associated with high levels of suffering and death. It's what we're calling the middle path. And the middle path is about being able to hold the virus at bay whilst keeping economic and social life going. And we think it's doable, but we also think that it requires a really high level of organization by governments and remarkable degree of engagement by the people, both of which in some countries is proving to be quite difficult.
Indeed, and I want to come on to that. And I'm fascinated by how you describe it as the middle way, and who's doing it right, and who should take more interest in the middle way, Professor. But let me ask you this, because you take a global view of these things. Am I right in saying that at the end of the day, we didn't really have a proper global response to this, that individual countries, in the end, they went their own way? Would that be unfair, or is that accurate?
No, it's totally right. Actually, it's explicable. Firstly, this is a brand new virus.
Indeed.
It's absolutely not like any other virus that those of us who've been involved in infectious diseases have encountered before. Even the SARS virus of 2003 was different from this one. And because it's new, we're learning about it all the time. So it's not surprising that quite a lot of governments said, well, the WHO is having to learn about it and they don't really know, so we'll go our own way as well. And we've already heard, even on this program, that there are quite wide variations. My own view is that that's short-sighted. If you're dealing with a common enemy, and this virus doesn't change whether it's in Britain or in Bahrain, it's still the same virus. We should surely be working on it together. But the reality is it's been a remarkably uncoordinated and disjointed response.
Tell me more about this middle way you were talking about, because as we look back, we can see when the pandemic began to gather speed, most major economies went for a lockdown. And people accepted that, but there was a real fear of the unknown. We don't know much about this. This seems to be the right way forward. We better do that. And then we, and by we, I don't just mean Britain, I mean France, Spain, even America, and other countries too, outside the Western Hemisphere. They began to pull back a bit from lockdown. And it seemed to be that we were getting a little bit back to normality. And then the cases started to rise, and the instinct of governments was then to move back, not necessarily to national lockdowns, but to a variety of different kinds of lockdowns. People are now beginning to think if this is the right response, that we know more about this virus now than we did before. We know it's rarely fatal for young people, but it is often fatal for those who are over 70s. Yeah. And maybe what we've learned now ought to inform our policy.
Yeah.
Is that the middle way?
Well, it's almost. I'm not going to go on long because you'll cut me anyway, but here it goes. The middle way is really trying to make certain that we put in place robust defenses against this virus so that if it does start to build up anywhere, we can catch it quickly and we can suppress outbreaks fast. To do that, we need really two things. One is very well organized, localized infectious disease control services. Sometimes they're called public health services. It's not hospitals, but it is testing, contact tracing, and isolation. The backbone to controlling this kind of thing is always testing, contact tracing, and isolation. The second part of it is involving local actors as much as possible, because dealing with small spikes of disease is best done locally. It's not best done from some central control center. And thirdly, it works best if people are as on side as they possibly can be. It does mean really leveling with people, saying, actually, the only way we can do this is all of us pulling together. Physical distancing, face protection, hygiene, isolating if we're ill, not going off to work or to the pub if we're feeling rotten, and protecting those who are most at risk. If we can combine those various steps, what we call doing it all in our organization speak, then we can get on top of it. That's what East Asian countries have done.
Indeed.
That's what Germany is doing pretty well to good effect. That's what parts of Canada are doing. And that's the approach that we believe should be adopted. We think lockdowns only serve one purpose, and that is to give you a bit of breathing space. So you just stop everything, the virus stops moving. And while you've got that breathing space, you should be really building up your testing, building up your contact tracing, building up your local organization, so that as you release lockdown, you're bound to get more cases, but you can deal with it really, really elegantly. At the moment, Western Europe's not quite there, but it could get there. And I actually have a lot of hope for Ireland. I've done a lot with Dr. Houlihan and his team, and I think they've got a good chance actually of being able to do it, hopefully without having to do another lockdown, but just localized movement restrictions in place.
Well, what did you make of the Irish politicians, the Irish government saying to its scientific advisors, no, we're not going to do that?
It's right that there should be interplay between the public health doctors and government. In the end, government has to take responsibility for balancing what might be seen as the trade-off between health and the economy. Our line is to say, let that be temporary. What we want you to do, because this virus is going to be around for quite a long time to come, is work out how you can keep the economy going and keep the numbers of disease cases down. And I suspect that's what's going to happen as a result of this latest wobble. They'll find an accommodation, and county by county, Ireland will get on top of this virus. It's happening, I think, already from what I'm picking up from colleagues. The only thing to watch out for is that sense among the public that they're being pulled around too much.
Yes.
And they don't do what they're asked to do.
Yes, and the rules have seemed to have got more. I mean, in the early days, lockdown rules were pretty, you may not have liked them, but they were quite simple to follow. Then now you take a notebook around with you. I mean, when the Prime Minister doesn't even know what they are, then maybe the rest of us don't necessarily know what they are. But, you know, sorry, Professor, on you go.
Andrew, just one thing. You know, this is so new, this terrible virus. It's not nice, it's horrible, it's dangerous, and it's cunning. This virus is so new to humanity. We're only 9 months into it, really, if you think of how long it's been in Europe. I think it'll take us quite a lot more weeks to really work out how we're going to live with this virus, what balance of risk we're prepared to tolerate, and also how we will collectively organize ourselves. But I reckon that early next year, we'll be feeling much more comfortable and it will become second nature. But right now, it's a bit stumbling in the dark.
We sometimes balk at the lockdown because it's yet another lockdown. We thought we'd all be over by September, October. It also, as I said, it gets very complicated and so on. But these are quite narrow personal inconveniences, and of course they can have economic impacts overall too. But we had Professor Sunetra Gupta from Oxford University on, and she was implying, and I'm interested in you because you have a global mandate, a global view, was that a problem we don't think about in lockdowns is that they're very nationalistic. That if we lock down our economy, then it hits our economy. but it also means we are not buying stuff, we're not trading with weaker economies, we are not just destroying our own jobs, we're destroying the jobs of all those that in the poorer parts of the world that export to us. That seemed to me to be a reasonable point.
Really important point by Professor Gupta. I want to say it again. We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. The only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted. But by and large, we'd rather not do it. Just look at what's happened to the tourism industry, for example, in the Caribbean or in the Pacific, because people aren't taking their holidays. Look what's happened to smallholder farmers all over the world because their markets have got dented. Look what's happening to poverty levels. It seems that we may well have a doubling of world poverty by next year. We may well have at least a doubling of child malnutrition because children are not getting meals at school and their parents in poor families are not able to afford it. This is a terrible, ghastly global catastrophe, actually. And so we really do appeal to all world leaders. Stop using lockdown as your primary control method. Develop better systems for doing it. Work together and learn from each other. But remember, lockdowns just have one consequence that you must never, ever belittle, and that is making poor people an awful lot poorer.
Indeed, and a rise in world poverty after years and years in which world poverty was falling and falling.